every once in a while I'm like before I was like, this is so cool, yeah. And now I'm like, some days.
Oh, look, I don't dance now, I make money move. Say I don't gotta dance.
Hey material girl, how are you? Thank you so much for coming back for part 2. This is things that I hate about dental hygiene, or that I dislike about dental hygiene. So if you're interested in seeing what I don't like, this is my personal opinion. Anything that I've been doing with dental hygiene that just doesn't interest me, please stay tuned. Alright, so hey, thank you so much for tuning back in. My name is T. I am a dental hygienist. I've been a dental hygienist for 6 years. If you love my content, please like, comment, and subscribe. This will help the algorithm. Y'all know how this should go. It's going to help somebody out there get to see this video and hopefully help them as well, and help you too. And it just will help me know that you guys like this content so I can continue to make it. Okay, situation with dental, medical, whatever, is going to be different. My career experience may be different from yours, but this is the things that I don't like, and some of it I can change, and some of these things I just have to accept. You know, either accept it and continue to work in dental hygiene, or don't accept it and find a new career to work in. You know, not much mobility other than teaching and working in sales. So when I say mobility, I mean when you get an associate's degree in dental hygiene, the ultimate entry goal is for you to work as a clinical hygienist, meaning you work in a dental office, cleaning people's teeth, teaching them about periodontal disease, teaching them how to brush, floss, all that, and removing calculus and plaque from their teeth, and working along the side the dentist to prevent cavities and periodontal disease. That is what the dental hygienist list of duties are. There's so many other duties. You can check on your dental association website, Board of Health website, to see what the duties in your state are, because there's some hygienists who aren't allowed to do certain things. Check that. But yeah, everybody's goal is just to start cleaning teeth. But then you get like maybe like 2 or 3 years in, and you're like, oh, this is boring, you know, or, you know what, I like this, but I kind of want to do something else on the side, you know, or, you know what, it's not like a hospital where a nurse works in one area. She works in like the neonatal unit, you know, with babies and working with baby delivery. And then she's like, you know what, I really don't want to work here. I want to work in the ER. Like, there's not much opportunity to move around as a hygienist. You either work in clinical hygiene and that's it, or you decide you're going to go teach, and then if you're not teaching, then you're in sales with Colgate or some other company like that selling products, or you decide to open your own business like a dental temp agency. You decide to do like dental consulting, which is like helping offices improve their hygiene or their dental scheduling program in their office. What else? You decide to be a professor, I think I said that already, or be like a faculty or advisor at a school, you know, at a college or something. Or you decide to be a dental manager, a manager of an office, of a practice. Or you can work in pediatrics or periodontics, which is, periodontics is the actual gum specialist. That's who a periodontics is. Orthodontics. Like, you can change your specialty that you work in as a hygienist, but that's not changing your environment that much, because you're still a clinical position. You get what I'm saying? So as a goal when you get out of school is to be in a clinical position, because that's where you're making good money, and that's where you're like getting your experience and you're hands-on with the patients, and you're in the office and you're seeing all these things. And eventually you're like, okay, I'm bored. It's very monotonous. It's very boring at a certain point where you're just like, I've been doing the same shit every day over and over and over. It's like you see a cleaning at 8 o'clock, you see another cleaning at 9, Then you probably have like a deeper cleaning, a scaling and root cleaning, a cleaning for gum disease at 11:30. Then you have lunch. Then you see another patient at 12, 1 o'clock, whatever it is. And they're here to maintain their periodontal disease. So it's like, after a while you get so used to it that it's like riding a bike, you know, so it gets boring. So all those careers that I had just listed, depending on the situation you get into, you really have to like really network and make your way around it and really get to know people and really research about these careers. You don't really make more money. I'm gonna say it again. Other than clinical hygiene, unless you are getting commission and you are the faculty, like executive professor of a program, you're not making that much more money. You're gonna get into this and there's somewhere to move up. You're not really moving up, it's more moving across. You're moving across. Teaching is moving across, because I have friends who are hygiene professors, clinical professors, who still work hygiene during the week or on weekends to supplement their income, because you don't make more money. Like, it's not like, oh, clinical hygienists make 75K a year. If I become a professor, I'll make 90K a year. Like, do not get into this for the money, straight up, because you're gonna hurt your feelings. You're gonna burst your own bubble. When you work with Colgate or sales for dental products, if you work for like Arestin, which is the company that sells, the company's called Aura Pharma. But if you work for Aura Pharma, going around doing like lunch and learns where you teach the faculty and the students and the staff about hygiene products and stuff like that they should be using in the office, you're basically doing sales. And yeah, you may make maybe 90, 100K a year, maybe. I'm not too sure about that. Look that up. If you do, you're out of the office clinically, but you still have a quota. You know, you still have things above your head. You still have a regional manager above your head that wants to make sure you have XYZ amount sold, you know, and this and that. So I'm not discouraging anyone from moving out of dental hygiene clinically. I'm just letting you know it's not like you start as a fry cook and then you go from fry cook to assistant manager, and then you go from assistant manager to manager, then regional manager, then corporate. Like, there is no moving up. It's just moving across, you know. And we make more than these dental office managers anyway, so they be mad at us. Like, you know, you might make as much as the regional manager. The regional manager may make a little bit more than you, depending on what city you live in, you know. But that's the only thing about it. Unless you're working in clinical hygiene in a really big, busy office, or the office that they're charging patients for fee for service, where there's no insurance, they just collect straight cash. Excuse that noise. That just collect straight cash. Or if you work in an office where you're getting commission, you're not really seeing more money. A bachelor's degree is not going to get you more money automatically either in clinical hygiene. The dentists don't care that you have a bachelor's, really. They think it's nice, but it's not really doing too much for you. So yeah, I don't want to discourage anybody about that. Sorry. I actually have a temp agency texting me right now, asking me, do I want to work some days this month that I still had left. So 1 second. I want to talk about is working with blood, saliva, diseases, sicknesses. So I'm going to make a separate video about this one day. I have it listed to like some things I want to talk about. But working with sicknesses, illnesses, diseases, being in people's mouth, touching blood, saliva, I'm starting to get to a point where it's getting to me. Before, I used to be okay with it. I never used to really care. I was like intrigued. I still am, but there's moments where I'm like, this is so gross. Like, I don't want to do this anymore. But I have moments when I'm like, I cannot do this anymore. Like, blood be scaring me. Like, if you're not into blood, if you're not into saliva, if you're not into like pus, plaque flying off people's teeth and into your face, and people coughing, dealing with hepatitis, HIV, HPV, dealing with AIDS patients, dealing with COVID, dealing with monkeypox, like dealing with the flu, dealing with all these sicknesses and diseases is like, it used to be okay, but once COVID came out, for me, I had a mental breakdown. I had an emotional breakdown because I was just so afraid of getting COVID. Like, especially at the height of it, before we really knew what it was and like all the like information on it was really out, especially in the dental world, I was so scared. Like, I was petrified to go back into the office after everything reopened, because I actually wasn't practicing dental hygiene for about like maybe 3 or 4 months, because there was an executive order for all dental offices and all surgeries and, you know, all medical stuff to be postponed if it wasn't an emergency. So from March 2020 till about maybe July, August 2020, I did not work hygiene because there were either no offices open practicing hygiene, and it was advised that hygiene not be practiced right now, or well, there is no or. That was what was going on. The government shut down dental for a second. Unless you had an emergency, you wasn't doing no cleaning, no teeth. And then it also took some time for the offices to get their patients back to come back, because everybody was scared. And the people that came in, they were like, I'm getting my cleaning, but I'm not doing anything else. Nothing else hurts. Like, it was very hard. It was a very, very, very hard time to deal with COVID. And now I'm like, and it was like we had to wear 2-3 masks. We had all of this PPE. It was like so scary. Like, every other week, one of my coworkers had COVID. When I say I was crying, like, not only was I broke from like, not broke, but I had really like financial stress because I wasn't working and I wasn't getting any unemployment. And I had rent to pay. Like, I'm not like a child. I have real bills, like, you know. And I had just moved from Florida by myself, so it was a lot. But anyway, but dealing with people who cough, I've seen patients throw up. I've had patients who gag so hard that they basically vomit, and it's not like I caused it, it's just they have a very severe gag reflex. I just seen so much in these 6 years, and I'm just like at my breaking point now. Like, every once in a while I'm like before I was like, this is so cool, yeah, and now I'm like, some days I can't take it. Another thing I don't like about hygiene is that there's a lot of responsibility, because you're the only one that can do your job. Like, you're expected to take x-rays, clean the patient's teeth, check the patient's medical history, check for cavities, check for any broken teeth, oral cancer if you see any signs of it, make your chart notes, also chart any new and existing fillings or anything that you see in a patient's mouth. You have to make their appointment. Most of the time in most offices you need to know the insurance code, so you need to make the treatment plan for you and the doctor. It is just like insane how much stuff I have to do. That's why I always tell you guys, like, y'all be asking me all these questions about like putting the camera in the office, and it's like I do so much, y'all won't even know what's going on. And besides HIPAA, y'all gonna be so confused about what I'm doing, because I'm literally running back and forth, and I have to do all of this stuff in 1 hour. It's like, it's out of control. And guess what? If a patient needs a cleaning, the doctors in dental school, you learn how to do hygiene all your first year, along with other dental procedures. But you learn how to clean teeth your first year. They know how to clean teeth. They know what calculus looks like, hard plaque, what it looks like on the teeth. They know how to detect it. They know how to, they're a hygienist before they're a dentist. Why do hygienists and dentists like have this pick back and forth where dentists do not want to do cleanings? Dentists don't want to do cleanings. They feel like it's beneath them. They do not do cleanings unless it's like a dire situation. And I know dentists who literally have no schedule happening. They probably have one crown to do, one root canal, and they see my schedule is back to back to back. I'm overbooked and I'm running behind because one patient was late or something. They will sit in their office on their phone, texting, talking on the phone, eating. They'll go sleep, whatever, knowing that my schedule is backed up like that. And it's like, a good dentist, especially if they own the practice, not a corporate office. If you own the practice and you hired me and you see that I'm behind and I'm the only hygienist here, or if my schedule is behind, you should offer to clean my patient, or at least get the assistant to get them started. They will literally sit there and watch you suffer and fall behind. And when I say something, I'm wrong. I'm not sitting here and letting you play me like that. Like, especially if I know that I'm doing the best I can, you know? So, it's a lot of responsibility, especially if you work in a place where you're the only hygienist. They're so outraged when you take a vacation, when you out, when you sick. Like, it's like you're a home mom. Like, you're the only person that knows how to do it, so they stressed when you're not there or when you can't. It's too much responsibility for me, and I've done that. I worked at a place, a 9 to 5, where I was the lead hygienist. I worked at a 9 to 5 where I was the only hygienist, and I worked at a 9 to 5 where it was 2, 3, 4 other hygienists, but I was the only one who worked full time, like 5 days. So, girl, it's a whole lot of, but I'll get into that in another video if you want me to. Please leave comments below about what you want to see or what you want me to elaborate on. And yeah, I do not like when a dentist is the boss and you have to work under them, because they be in their motherfucking feelings, okay? When the dentist is the person you work for and they pay you and they're in charge of like coming to check the patient and like this is their patients and all that, they have like a certain level of entitlement above you because they're your boss. When I work alongside a dentist in a corporate or what's called a DSO, an office that is a chain of dental offices, they don't press me like that because they don't pay me. When that money that you're making for them is coming out of their personal bank account, their personal business account, that they pay their family with, that they're paying their family's bills with, they paying their kids' private school tuition with, oh, best believe they act different, okay? They move different. So, I don't like that environment. I know definitely what I don't like about that, because they move different. When they paid out of pocket for the equipment, the x-ray equipment, all of that, they act like it's theirs, so you better act right, don't break it, don't touch it like this. And mind you, I'm very careful, I'm very responsible with my things, even more responsible with these digital sensors for x-rays that cost $10,000. When it's his or hers $10,000, that's coming out of his pocket that he got to pay back, best believe he have a serious attitude. He is not nice about it, you know. When you are basically paying their bills, when they have overhead, they have to pay all of that, they act different. I'm good. I don't need no dentist to be my boss. I don't need no fucking man to be my boss. I'm good. I'm over that shit. Money is made hourly and you have to fight for a raise. I wrote that down. When your money is made hourly, you're like slaving, because sometimes remember I told you, it depends on the environment you work in. If you work in a private office, because there's different types of offices. If you work in a DSO is kind of like corporate but a little smaller. If you work in a private office, that means you work for the dentist. That is his business. He bought that building or he bought that equipment. That is his business under his name. If you work for a facility like a military base or a correction office facility, like where there's prisoners or soldiers, that's different because they all get paid differently. Some people get paid depending on what you agree to. They work either salary, which is meaning you get paid yearly, like a set rate yearly. So every month you get a paycheck, but it never changes no matter how many hours you get. Or you actually get paid a different amount hourly, and depending on how many hours you work a week, you get paid that amount. It's not a set amount like a salary. Dentists have a very hard time, or companies have a very hard time giving hygienists a raise, like a good raise at least. They be fighting tooth and nail with you for your dollar, your $2, your $3, your $4, your $5, and it's not like there's some type of regulation on salary. You know, like, okay, you will have to make a contract, like, okay, after 2 years of employment, I'll get a 2% raise. After 3 years of employment, I'll get a 4% raise. Like, you need to know that kind of contract, because most of the time, there is no contract. There is nothing in the contract about that. So, or if there is, it's like, it's shit. It's not a good raise. So, they want to fight you tooth and nail. They want to fight you on giving you benefits. If you work in a private office, a private dentist you work for, he doesn't think he needs to give you benefits. He doesn't think he needs to give you medical benefits. He doesn't think he needs to give you a 401k, vision, dental, any of that. They expect that you make more hourly than an assistant, so you should be paying for that out of pocket on your own, and you'll have to go find it. Or if they do give it to you, it's shitty insurance. I constantly have back pain, wrist pain, strains on my body. I've told you guys in several videos before, or on TikTok actually, that your ergonomics in this job is so messed up. Like, if you're not careful and you overwork yourself, or if you're not working out, you're not sitting up correctly, you're not using a fulcrum when, like, a stable grasp of the instrument and holding the instruments correctly, and you like leaning over to see patients and stuff, you can end up hurting your neck, your back, your shoulders, and all around your body. You can end up having like wrist pain. I feel like I'm developing carpal tunnel from time to time. I have spasms in my wrist and down my arm and my elbow. And, you know, I just tell you to just see a chiropractor, get your daily or weekly, monthly massages, use your massage balls. You know, like I have one right here. I shared this on my TikTok on live. I have a massage ball, and then I have like this massage cream that's kind of like byeee, but like times 10. It doesn't smell that bad. It doesn't. And I just like squeeze it. Like, these are hard. And I just squeeze this ball. And I also use this and I put it in my back and I roll on it. And I use this and I just like roll out my muscle, because if I don't, I'll be in such pain that I can't work some days. And it's hard. It's really hard. And imagine me. I've only been in the field for 6 years. Imagine somebody who's been working for 30, 40 years. I know hygienists who've been doing this for a long time, 30, 20 years, whatever. They had to go get carpal tunnel surgery. They had to get rotator cuff surgery from constantly lifting their arm like this, rotating to get the light that's above our head. Girl, so I will tell you right now, clinical hygiene is only probably about a 10 to 15 year max. And if you have to slow down after that 10th year, because you're going to start to get wrist and back and body problems. Your eyesight, from constantly trying to see those little markings. That's why we wear those loops on our eyes, like those glasses that have the magnification. We wear those. It's just a lot. It's a lot on our body. So I would say the most you got with this career in a dental office working on patients, I don't know about like The other stuff, like being a teacher and stuff like that, only probably about 15 years tops before you start feeling it on your body and you're hurting. Another thing is that people either love you or hate you. The dental office is a place where as soon as a patient sits down, new or young or whatever, old, Spanish, black, purple, white, male, female, dog, cat, they always say, I hate the dentist. I hate being here. Make this quick. I'd rather do anything but do this. Are you gonna pull my teeth out? Like, some of it is funny, some of it is a joke, and then other times it's like so annoying. And eventually you gotta try not to let it get to you, but eventually you just realize, damn, don't nobody like being here? Like, everybody hate me, huh? You know, like, you get to a point where you like, I hate it here, cause y'all hate it here. You know, like, people either love the dentist or they hate it. They love you as a hygienist, or they hate you as a hygienist. That's it. You cannot please everybody, and that's just in life in general, but you cannot please everybody. And there's gonna be moments when you're like, what am I doing here? What did I do this for? Like, you know? But literally, like, people are afraid of the dentist. They have severe anxiety most of the time. It's cute with the scrubs and like the quick appointments and stuff, and you know, you get to wear your hair, and you know, it's cute to work in the healthcare field, but people don't like us for real. They hate us. One thing I don't like either is you can't take this on the go. Like, the clinical job, you can't take it on the go. Like I said, teaching and working for Colgate or something like that, you get to travel, you get to probably work from home because you have to check emails and it's more administrative sometimes, so you get to take that home. But sometimes, some days, I really just want to work from home. I want to work from home. I don't want to go into the office. I wish I had that flexibility, you know. But also, okay, my video had cut off. But I was talking about the fact that you can't really take this home. Like, this is not something you can take home. So you're forced to go to work every day. You're forced to really interact with patients. If you're sick, you don't feel good, you stay home. Or like, if you having those days when you have serious cramps, you gotta still work. Like, you know, it's not like I'm sitting at a desk and I can kind of be like hunched over somewhere. Like, I still have to sit up and interact and talk, and it's a very active job. You know, I'm not sitting down. Half the time, if I am, it's only to do the cleaning, and that's it. I'm getting up. What I don't like is that it's mostly women in this field, or just male dentists and a whole bunch of women working in the office. I'm hardly in an environment where it's any men, so that annoys me, because sometimes there's cool energy in the office, but I also have the tendency to be like an alpha female. So I come off very like intimidating and aggressive to people, and it's not that I'm like intentionally trying to be mean or anything, but I'm very assertive, I'm very logical, I'm very like, I'm here to come do my job and that's it. I don't want to talk about nothing else. I don't want to see nothing else. I'm friendly, excuse me, I'm friendly, I talk, I make small talk with you, I'm not mean, but I feel like women can be so catty sometimes that it creates drama in a dental office. And I feel like sometimes you need male masculine energy there, not just females who have masculine energy, but actual men in the office to kind of like break up that shit. You know, there are some men who are still just as messy and drama filled and catty as those women, and yes, I've seen that. I've seen 2 or 3 men working in an office and still be like Mitches. You know, those munch type dudes who be in a space and it's like, why you in female business? Like, watch yourself, move. Like, why you in female business for real? Like, you know, it's like too much extra stuff. And then sometimes you work with females, or a female is above you in a leadership role, like a manager or something like that, or if the my hygienist who has more responsibilities than you, she feels like she could tell you what to do, and this one is jealous of this one, and it just be, I just want to be here, help the patients, make my money, and go home. That's what I be trying to do. But in a woman environment, a very female dominant environment, it's very hard to keep that balance. For some, and then I come off like this really like aggressive person, and it's like, I'm not. Or I seem standoffish. I seem like I don't want to talk to nobody, and it's like, I don't. I'm here. I'm here to do my business and go. You know, I'm not here for all that other stuff. I'm not here to make friends. I'm not here for none of that. You know? I already talked about that. You have to work to get your own healthcare, your own 401k, your own savings. We're basically kind of like independent contractors. When we work for ourselves as travel hygienists. If we're not doing that, then also, like I said, there's some dentists that you work for privately who just refuse to provide you with health insurance and 401k and things like that. They feel like they pay you enough hourly, or they pay you enough salary because you make 80K a year, you don't deserve insurance, and you have to go find it on your own. Or you have to be, luckily if you do, you have a partner who will pay for your insurance with you, you know. So those are the cons. And like, you can be sued. You can be sued. You can be sanctioned for your license to be put up at the board, things like that. Hardly ever do you see a hygienist get sued. But my thing is that the fact that you can even do that to me scares me, you know. We do have personal liability insurance that you do have to obtain once you have a license. So I do have personal liability insurance. So if I ever am sued, you can just look through your policy when you do have that, and just see what it entails. It's like car insurance, you know, like you get sued, but you don't lose your license because you have that insurance. But there are times when if you mixed up with a dentist or a company or something that is doing things that are negligent or doing things across the malpractice route, you can be personally sued by a patient, a hygienist, another hygienist, a company. So that's the only thing. Like, if I was working for like Chase, I wouldn't get sued, you know, because unless I was doing fraud, you know. But this field is like, if somebody feels some kind of way about you, or you miss a few things in your note that were important, or a patient has oral cancer now, or their family member that you were seeing as a patient died of oral cancer, and you failed to pick up on it, like, you have an obligation, a right to report things that you see. If there's a child who's coming with child negligence and you didn't report it, you know, you had a risk of HIV and you didn't report it. Like, there's just so many things in this field that you have to report for. And I just be praying to God that nothing like that ever happens to me. And I try to be very detailed and thorough in my notes and in my medical histories when I'm going over it with the patient, and really being careful with my license and don't do anything that I don't feel comfortable doing or I'm not supposed to do that's out of the scope of my practice. And I just go from there, and I just keep my personal liability insurance active, and I'll just keep up with my my laws, just knowing my laws, knowing what I need to do. And the best way to do that is just keeping up with your dental association in your area. And if you don't already have one, you're not joined, then keep up with like websites that do like dental hygiene and dental news, like today's RDH and stuff like that, just to keep abreast of what's going on. So I do that, and I just pray it doesn't happen to me. It's very rarely that a hygienist loses their license, but it's out there. So that's the only thing I don't like, is that you can lose your license. So if you do some stupid shit, but that hardly ever happens. Hardly ever. You have to really, you get 3 strikes, and some people still practice. So yeah. But anyway, I hope that this was a very informative video. I hope this helps someone out there. I hope you guys really like this content. And like I said before, if you have any questions, please email me or leave a comment below. I hope this video really helps somebody. And if you love these videos, please like, comment, and subscribe. I plan on having way more content on dental hygiene, of course, and vlogging, and just like all lifestyle, beauty, entrepreneurship, dental hygiene, of course, and just like vibing and just going with the flow. And of course, thank you so much for watching, and I hope you have a good day, and tune in next time.